Mr. Speaker, I rise to speak in support of H.R. 2507, the Newborn Screening Saves Lives Act of 2019. Newborn screening is critical in early detection and intervention for conditions, some life-threatening, for our nation's infants. These screenings inform both physicians and the families of a newborn what steps may be necessary to treat or prevent further health complications as the infant ages. The Newborn Screening Saves Lives Act, which passed for the first time in 2008, aims to improve the ability to address pediatric health by standardizing newborn screening programs. Newborn screenings are incredibly important in providing physicians and families with information regarding their baby's health, enabling them to practice early intervention and treatment if necessary. According to the March of Dimes in 2017, only 10 states and Washington, D.C. required infant screening for the recommended disorders. Since enactment of the Newborn Screening Saves Lives Act, all the states, D.C. and Puerto Rico, screen for at least 29 of the 35 recommended conditions. This bill would reauthorize funding for the Health Resources and Services Administration, the Centers for Disease Control and Prevention, and the National Institutes of Health to ensure that our newborn screening remains comprehensive and that our nation's health care providers are adequately equipped to conduct the screenings. Newborn screenings are for serious but rare conditions that families and doctors may otherwise be unable to detect at birth. Newborns are screened in the hospital when they are 1 or 2 days old by blood tests, in addition to hearing and heart screenings. About 1 in 300 newborns has a condition that can be detected via newborn screening. By catching these disorders early, many can be managed successfully, allowing children to live fuller, better lives. However, if not detected and left untreated, these conditions can impact a child for the rest of their life by causing disabilities, delays in development, illness, or even death. Prior to the passage of the initial bill in 2008, states had varying standards for newborn screening. Some states were only screening for 4 conditions in 2002, when other states were screening for more than 30. Reauthorizing the Newborn Screening Saves Lives Act will allow CDC to work with states to continue to level the playing field and provide more equal access to newborn screenings across the country. H.R. 2507 also reauthorizes grants through the Health Resources and Services Administration that not only allows for expansion of screening programs, but improved follow-up care after a detection. The bill also allows for the continuation of the National Institutes of Health Hunter Kelly Newborn Screening Program, which helps to identify new treatments for conditions detected in newborn screenings. I applaud Representatives Robal, Allard, and Simpson for their work on this bill, and I urge my fellow members to support H.R. 2507. Mr. Speaker, I have no further speakers at this time. I urge passage of this bill, and I yield